This video is designed to introduce the advanced EMT student to the intravenous therapy skill in accordance with the National Registry of EMT skill sheet. The first step is to check the selected IV fluid to ensure that it is the proper fluid, to ensure that the fluid is clear and that the fluid has not expired. Next, the proper catheter must be selected. Catheters come in different sizes or gauges, typically running from 14 gauge to 24. The lower the number, the larger the diameter of the catheter. Anything 18 gauge or below is considered large bore. The proper administration set must also be selected. Administration sets come in 60, 20, 15, and 10 drop increments. The number on the drip set correlates with how many drops from that particular set is required to equal 1 milliliter of fluid. 60 drop sets are useful to accurately infuse medications or fluids where specific doses are required. 10, 15, and 20 drop sets are useful in delivering large amounts of fluid over a short period of time. Now the IV tubing must be connected to the IV bag. It's important to use aseptic technique throughout this procedure. This is commonly called spiking a bag. The plastic cap must be removed from the IV tubing and the rubber seal must be removed from the IV bag. The spike on the tubing is inserted into the port on the IV bag and twisted until the hub is completely bottomed out into the IV bag. The drip chamber must be filled. This is done by gently squeezing the chamber and allowing it to fill approximately halfway full of IV fluid. Once the drip chamber is appropriately filled, the remainder of the IV tubing must be flushed to eliminate any air from the line. In order to be prepared, it is important that you tear your tape at any time prior to the venipuncture. Specially designed adhesive bandages may also be used to secure your IV. Body substance isolation precautions must be taken prior to beginning venipuncture. Failing to do so will result in failure on the National Registry exam or on your skills checkoff. You are now ready to apply the tourniquet. The tourniquet should be applied with a loop folded underneath to allow for it to be easily removed. Next, you must palpate for a suitable vein. The site of the venipuncture must be properly cleaned with an antiseptic, cleaning in ever-widening circles from the inside to the outside. Performing the venipuncture consists of the following steps. You must first insert the stylet. The stylet's inserted at a 45-degree angle to the skin, which can then be lowered after the puncture. The catheter is then advanced. Flashback should be noted in the flash chamber on the IV needle. Next, the IV catheter should be occluded. This is done by using the tip of your finger and putting firm pressure over where the tip of the catheter is under the skin. With the catheter occluded, the stylet is removed and the IV tubing can be connected. The needle must be disposed of in a proper sharps container. Failure to do so will result in failure on the National Registry examination or failure in the skill checkoff. You may now release the tourniquet. You must open the roller valve and flow the line for a brief period of time to make sure that the line is patent. The IV catheter must now be secured. If you're using tape, use the double chevron method, folding one chevron above the catheter towards the patient's torso and one chevron folded over the catheter pointing towards the patient's fingers. Then secure the entire catheter with one additional piece of tape. If you're using the specially designed adhesive bandages, use as directed. The flow rate of the fluid must now be adjusted. The following critical criteria will result in failure at the skill station. Failure to establish a patent and properly adjusted IV within 6-minute time limit. Failure to take or verbalize appropriate body substance isolation precautions prior to performing venipuncture. Contaminating equipment or site without appropriately correcting the situation. Performing any improper technique resulting in the potential for uncontrolled hemorrhage, catheter shear, or air embolism. Failure to successfully establish the IV within 3 attempts during the 6-minute time interval. Failure to dispose, verbalize disposal, failure to dispose of or verbalize disposal of blood-contaminated sharps immediately in proper container at the point of use. Failure to manage the patient as a competent EMT. Exhibiting unacceptable affect with patient or other personnel. Use of or ordering a dangerous or inappropriate intervention.